Hello, good morning, good afternoon, everyone, and welcome to this briefing of the Pan American Health Organization. Today, Thursday, March 28, 2024. My name is Luciana Viega, and we're going to talk about the dengue situation in the region of the Americas and other health matters. I will begin with some logistics. We will moderate in Spanish, but as always, we have simultaneous interpretation in English, French, Spanish, and Portuguese. We will take questions as much as we can in the original language. You can raise your hands on Zoom, or you can use the Q&A button for your questions. Please remember to write your name and the outlet. This is a space for the media. We will give priority to questions from journalists. We will begin with the words from Dr. Jarbas Barbosa, and then we will go on to the questions. We have, together with the director, Dr. Rhonda Seeley Thomas, Assistant Director of PAHO, Dr. Sylvan Adegieri, Director of the Department of Prevention, Control, and Elimination of Communicable Diseases of PAHO, and Dr. Daniel Salas, Executive Manager of the Special Program for Integral Comprehensive Immunization of PAHO. Now over to Dr. Barbosa. Hello, good morning, and thank you for being with us in this press conference. I would like to give you an update on the current situation of dengue in the Americas. As of March 26, 2024, the Americas recorded more than 3.5 million cases of dengue, including more than 1,000 deaths. This is a cause for concern since it represents 3 times more cases than those reported for the same date in 2023, a record year with more than 4.5 million cases reported in our region. The increase in dengue cases is observed in all countries of Latin America and the Caribbean. However, 3 countries in the subregion of the Southern Cone, Brazil in particular, followed by Paraguay and Argentina, are the ones most affected by the current epidemic, representing 92% of all cases and 87% of deaths related to dengue. In general, dengue follows a seasonal pattern, and most of the transmission in the southern hemisphere happens in the first half of the year, which explains why the subregion sees an increase in cases at this time. In the south, the first months of the year correspond to the warmest and rainiest season, when a greater circulation of the main vector of dengue is observed. And we're talking about the mosquito Aedes aegypti. However, in other countries in the region where we only expect a high transmission in the second half of the year, such as Barbados, Costa Rica, Guadeloupe, Guatemala, Martinique, and Mexico, we are also currently seeing an increase in cases. There are 4 serotypes of dengue, and the simultaneous circulation of 2 or more serotypes can increase the risk of epidemics and serious forms of dengue. 21 countries and territories in the Americas have reported the circulation of more than one serotype. We are also seeing the presence of the vector mosquito and cases in geographical areas where no endemic transmission had previously been seen, which means that some countries may not be prepared to cope with an increase in transmission. The Pan American Health Organization maintains rigorous monitoring of dengue in the region. In the last 12 months, 9 epidemiological alerts and updates have been issued. These documents have highlighted the increase in dengue cases in the Americas and have provided essential guidelines to our member states for the prevention and control of this disease. Factors that favor the high transmission and dispersion of dengue and spread of dengue? Well, these are several factors that favor the spread of the mosquito and high transmission of dengue. Environmental causes play a key role. An increase in temperatures and a greater frequency of extreme weather events such as heat waves, intense droughts, which lead the population to store water inadequately, for example, and storms and floods can increase the proliferation of the vector mosquito. The El Nino phenomenon that we are currently experiencing can also contribute, since we often see peaks of dengue transmission during those years of El Nino due to climatic variations. But social determinants, such as rapid population growth and unplanned urbanization, can also boost spread of dengue. Precarious housing conditions, insufficient water and sanitation services, and inadequate waste disposal contribute to the spread of Aedes aegypti. In conditions of adequate temperature and humidity, discarded objects can store water and they serve as breeding grounds for mosquitoes. There are actions that we can take to prevent and control transmission of dengue and prevent deaths. Since 2010, BAHO has been supporting countries in implementing a comprehensive strategy to control arboviruses such as dengue, which has helped save thousands of lives. Our approach includes strengthening surveillance, comprehensive surveillance of all arboviruses, including dengue, Zika, and chikungunya, improvement in diagnosis and treatment, with an emphasis on the early detection of warning signs and the timely attention of patients to avoid serious and fatal complications. Since 2020 alone, BAHO has trained more than 360,000 health workers in management of dengue through face-to-face and virtual sessions. And the implementation of efficient and effective strategies for controlling Aedes aegypti that prioritize high transmission areas and incorporate new technologies such as Wolbachia, which can prevent the mosquito from maintaining infection with the virus. Despite the record cases in 2023, dengue case fatality rate in the region remained below 0.05%. This is important because we can have an increase in serious cases and deaths with the disease. However, BAHO calls and makes an appeal to all countries to support dengue prevention efforts, in particular through the following actions, such as intensifying efforts to eliminate Aedes aegypti breeding grounds and protect themselves from bites, since these are the main measures to prevent the spread of dengue. Health ministries must prepare health services and health personnel as well for early diagnosis and timely clinical management of patients with suspected dengue. Continuing efforts to inform and educate the population so that as soon as the first symptoms appear, including abdominal pain, persistent vomiting, drowsiness, restlessness, and bleeding, they will seek immediate medical care. Finally, dealing with dengue is a task of all sectors of society. We must involve communities to succeed in our efforts to control populations of mosquitoes and prevent serious illness as well as deaths. The media play a key role. is in this effort by disseminating prevention messages and recommendations to the population, along with um, combating disinformation. And I am counting with your support in all of this. Thank you very much. So now we're going to questions. We can ask questions directly. You can raise your little hand on Zoom or use the Q&A button. We will begin with a question we received beforehand from Mauricio Torres from CNN in Spanish. The first question from Mauricio is, does PAHO have a projection of the number of cases um, of dengue by the end of the year? Maybe we will have the largest historic numbers. Dr. Aldeguerri, over to you. Thank you very much for this question. I want to tell you that transmission periods are not limited to the 12 months of the year. The cycles are longer, and regularly they go up to 2 or 3 years. The cycle that started in last year, 2023, and which still continues through the first quarter of this year, 2024. With these trends, we can say that 2024 will report more cases regionally. We have 1.5 more times reported in this first quarter than in the same period in 2023. I would like to emphasize also that our first priority is to avoid deaths, controlling mortality, and we've been working for several years to maintain that number under 0.05%. And at this point in time, this figure is less than that, which is our goal. But during great outbreaks, it's a great challenge always to make sure that those deaths increase. And this is at the core of the comprehensive strategy promoted by PAHO. Thank you very much. Thank you, Dr. Aldeguerri. Now, a second question by Mauricio Torres. We know that Brazil has the highest number of cases in the region, about 80%. There are other countries and or cities that are on alarm because the disease is expanded quickly. And the third question, I'm going to ask it also right now. He says that WHO's director has says that dengue is associated with changes in climate. Are there other diseases that are affected by climate change? Dr. Aldeguerri, maybe over to you again, or maybe to the director? And then over to Dr. Aldeguerri. Well, thank you very much for the question. As I said before, we have this year already a large number of cases, not only in Brazil, but also Paraguay and Argentina and other countries, even Uruguay, in areas where there used to be no transmission of dengue for a long time. Some dengue cases have been identified. So the combination of the El Nino phenomenon and other climate changes endangers all the large cities in the tropical and subtropical areas of our region because they concentrate favorable conditions for the Aedes aegypti mosquito to proliferate very quickly. So it is very important to maintain surveillance and control vectors and reduce the risks of death due to dengue, also strengthening the health systems. Other climate change can also affect other diseases other than dengue. Zika and chikungunya are also transmitted by Aedes aegypti in South America, but in the Amazon basin, we have malaria, and we can see a number in the transmission of malaria cases. So all vector-borne diseases can be affected by climate change. And this year, with a combination of climate change as well as El Nino, this becomes an increasingly higher risk. Thank you. Director Dr. Aldigueri, would you like to add something about other diseases and climate change? I guess Sylvain Aldigueri is having issues with his connection.
Hi there, this is Gabriella from NPR. I am interested in the situation that's unfolding in Puerto Rico. I understand they declared a health emergency. I would love to understand what's happening on the ground and also if this is happening in the drier season. My understanding is that's unusual. Can you talk to the situation there?
Good morning, and thanks for the question. So in the Caribbean, so far for the year, they've reported just over 25,000 cases of dengue, confirmed cases. We've had a few deaths as well. And the most countries most affected include French Guiana, Martinique, Guadeloupe, as the director would have just said, Puerto Rico, and the Dominican Republic. In terms of making sure that we get correct information, PAHO actively engages ministries of health in terms of epidemiology and for training to make sure that we have similar case definitions throughout the country so that we can ensure that when a country reports a case of dengue, it's standardized. And also we assist countries in making sure that they have the necessary lab capacity so that they can confirm that they have dengue cases. And we encourage countries to report both the suspected and confirmed cases to us using our case definition so that we can have standardization and get as accurate information as possible. Thank you. Over.
Hi, thank you so much, Luciana, and thank you so much for doing this. I have a few questions. The first one is this the worst dengue season you've seen, or have there been worse ones in the past? And can you talk a bit about the risk of spread, even to, northern regions? We heard the chief scientist of the WHO warned earlier this year that, dengue could become endemic in, the southern parts of the United States, for example. And also, do you have a tally of how many countries in the regions of the Americas have declared a public health emergency so far regarding dengue? Thank you.
We have received a question from Matthias Levy. The question is, to what extent the um, prior people who have had dengue in the past, are they protected? And this should be related to priority with respect to whom is going to receive vaccines against dengue. Thank you for the questions regarding whether having had dengue previously, would this mean that the person is protected, or should you defer vaccination? Well, in the phase 3 trials, we've seen that people who have been previously exposed to dengue could benefit more from the vaccine. Now, we need to note something. The tetravalent vaccine that we currently have, it is an unbalanced vaccine, which means that because dengue has 4 serotypes, it's very hard to have the same effectiveness, in this case, efficacy in phase 3 trials for all serotypes. So if a person has already had, say, type 2 dengue, the vaccine is strong against serotype 2 dengue, but if the person has already had type 2 dengue and the person is vaccinated, the protection won't be as high as if the person didn't have type 2 dengue. It's very hard to determine this in public health programs, but the clearest answer is that the benefit is greater when a person has already had dengue before. And the recommendation issued by PAHO through our TAG technical advisory group on vaccines, ideally vaccination should be in a more controlled environment, in stage 4 trial, to complete the efficacy and safety profile in the vaccine, especially in people who have never had dengue before, and especially for serotypes 3 and 4. Of course, we respect each country's conditions and their sovereignty to decide exactly how they're going to use the vaccine. Is it a phase 4 trial basis or in a more extended way? Thank you. Thank you, Dr. Salas. We have some question here about availability of vaccines by PAHO. Now over to Dr. Barbosa. I will read only one question from TV Global. Is there a plan to facilitate distribution of vaccines in the region? Yes, thank you. I'm going to answer in Portuguese.
I will answer in Portuguese. Thank you for your question. First, let me highlight that the available vaccine is a 2-dose vaccine that requires a 3-month interval between doses. So the vaccine is not a tool to control transmission right now. There are studies that have been conducted that have shown that only after 8 years of vaccination programs would there be an impact on dengue transmission. So the tool for really curbing the transmission is eliminating the mosquito vector, whether in the households or public spaces and commercial venues, so that we are able to reduce the population of mosquitoes and, as such, the transmission, and also the preparedness of healthcare services to better identify and respond to cases with, that could become serious. The currently available vaccine is being produced in a very limited fashion. Takeda, the manufacturer, has a limited manufacturing capacity of vaccine. Brazil is the country that is using the vaccine the most, Argentina as well. And that is relevant because those are countries with a good health surveillance system, a good system for the notification of adverse events, and that is useful for us to see the real life effects and impact of vaccines. So it will increase our knowledge about the vaccine. Our fund for vaccines at PAHO, we we have a limited amount or number of vaccines available there, but we are making that available. And our immunization manager, as mentioned, because this is a new vaccine, we have to be extra vigilant to identify how it will behave, in the real world. For example, for different serotypes, the phase 3 clinical study for this vaccine occurred at a time, just to give an example, that that serotype 3 was virtually not circulating. So for dengue 3, we don't have as much data. So now with the real life use of the vaccine, we'll have more information about its effectiveness and how it will play out with this serotype. So the preparedness of healthcare, of the healthcare system is also to collect that data. And this is a vaccine, let me remind you, is a partnership between the National Institutes of Health in the US, the Butantan Institute in Brazil. It is a vaccine that is in phase 3 studies. It is this new vaccine is a single dose vaccine, which could accelerate the use of the vaccine, but that will only be available by 2025. Thank you. Thank you, Director.
Thank you very much. We continue with questions from Brazil. We have several journalists connected. Mariana Rosario from O Globo has the floor. Mariana?
Mariana, good morning. Good morning. Sorry, I was having a hard time opening my audio. I'll speak Portuguese if that's okay. My question is about the dengue data in Brazil. We have seen a large increase of deaths, or investigation about deaths, and there is not certainty whether or not those were caused by dengue. So my question is whether there is any issues with these data, if they're being held out, and the impact of these data. Thank you, Mariana, for your question. Dengue, Mariana, is a disease with very specific characteristics. Most cases are very mild, to the point that people don't even go to healthcare services because they get confused with a common cold. For surveillance, for the healthcare systems, we work with the Pan-American countries to strengthen the surveillance system so that we can immediately identify when there is an increase trend in the trend. So that's an important part of the technical cooperation that we have in the region. The investigations on the deaths, they are important because often there are comorbidities, and that will require committees from the ministries of health. By using international criteria that are standardized, they can better assess whether a death is directly related to dengue or not. But what is important, and that was mentioned at the beginning, is that even though the lethality in Brazil with a good surveillance system, a good preparedness, although we see small numbers that are below the 0.05% rate, I believe that we can double down on our efforts to train healthcare professionals, inform the population about the alarm signs for serious cases of dengue, because I believe that we can make the lethality drop even more. Thank you. Thank you, Dr. Jarbas.
Yes. Good day. Can you hear me? Thank you. So thank you for this. And I was wondering if you could tell me if there's a particular type of serotype that's been most identified this year compared to previous years, either 1, 2, 3, or 4. And And also, sorry, I'm having trouble here with my documents. And also, how many countries, if any, have requested vaccines from manufacturers? Thank you.
I give the floor to Paula Escalada from Agencia F. She had raised her hand. Paula, can you hear us? Hello? I apologize. Please go ahead. I was just replaying the audio and I had emailed my question, but it is the following. And I think that you have already answered it in part, and it has to do with the vaccines. I wanted to know precisely whether the government should focus more on the vaccine and also what the current situation is. But I think that this has already been addressed by now. But if you have anything to add, I would be happy to hear. Thank you. Dr. Salas, would you like to add something to what the director said? Certainly, just to reiterate what the director explained quite well, our current vaccine is not a vaccine that will control the dengue epidemics. It has to be used as to supplement the situation, but we do need to carry out field operations to prevent, to educate on the vector, but the advisory technical group suggested that any country wanting to use the vaccine needs to have strong surveillance for adverse events, because any signal, any sign of any adverse event needs to be reported immediately, needs to be researched, the causes need to be identified. And also there has been a recommendation to have a strategy to reach out timely to the population, because we need to remember that at the end of the day, we cannot wait for the population to think that because they are vaccinated, definitely they are not going to have dengue anymore, because cases will decrease. We need to mention that the vaccine has a limited scope, and this is also related to the safety profile that still has to be determined. We need to have a clear campaign to communicate from the point of view of the governments, and we need to recall that this is a vaccine that is recommended for a population between 6 and 16 years of age. So any country that is considering this vaccine needs to have an established campaign already of vaccination for children, for vaccination to be more effective. Thank you, Dr. Salas. Now I am going to read a question from the German agency. Michael is asking, South America is having the worst epidemics, dengue epidemics, since the beginning of any sort of record keeping. And what is the meaning for European countries that currently do not have any much prevalence of dengue? Can we talk about a warning for other regions of the world so that we can implement any measures? Dr. Aldigueri, yes, with pleasure. I would like to remind the colleague that the WHO Director General has declared a situation of emergency globally, and this was in late 2023. There are important problems, significant problems in the Middle East and also in India, and also in African countries from the Sahel area, in addition to the situation in some countries of the Americas, some of the sub-regions. So that is the first comment. What can we make of what is going on in our regions? We have in Europe a completely different situation. Over the last couple of years, there had been sporadic outbreaks that have been quite limited, and they were reported in Southern Europe, in France, Italy, and Spain. In this case, the challenge that European countries have is to control those vectors, hotspots, and that has to do with the different species of Aegypti that we have as the enemy in this region. So the challenge for European countries is different from the challenge faced in the Americas, where in addition to the community participation for environmental management, we need to reduce and maintain very low mortality in our countries. And I hope I have addressed the question by our colleague. Thank you. I thank you, Dr. Aldigueri. Valeria Roman from InfoBias sent us a question in the chat. Are you connected, Valeria? Would you like to read it? Please go ahead. Hello, it's a pleasure to be here. Thank you very much. I wanted to ask if, taking into account that just 1 out of 3 dengue cases are symptomatic, that is to say, there are many asymptomatic cases, how do you determine that these epidemics, mainly in South America, could be empowered by asymptomatic cases that are not being taken into account? And next, whether it is possible that given the current emergency of the dengue throughout the Americas, WHO could declare the public health emergency of international significance as we had it with Zika in 2016. That's all. Thank you. Thank you. Dr. Aldigueri, would you like to address this question? Certainly. I can start by answering the latter part of the question. And this is what I explained as part of the response to another question. The WHO Director General has declared an emergency globally as to dengue by late 2023, but this is not a global emergency of significance, important or international significance as established in the international regulations. It is just a way to warn the populations, the governments, the local governments, and also to make sure that there is equitable access to the input to address the outbreaks. As to the first part of your question, if I understand correctly, and how to manage the expectations and timeline for the disease, whereby 2/3 of the cases do not have any clinical presentation or manifestation. This is the regular challenge that we have had with these arboviruses infections or diseases, but now given the dynamics and also given the important number of cases that we have declared and properly characterized and also identified by means of epidemiological surveillance and also characterized by means of laboratory surveillance, we have the necessary input to carry out a risk assessment and anticipate the answer, the response. And once again, I go back to the key messages of the organization. To reduce mortality implies early detection of cases, early detection of severity symptoms so that we can take the patient to health services. And the second important comment is we need to have community outreach for proper environmental management. We have very challenging examples in large urban populations in the hemisphere where the environmental management is quite challenging for local authorities, and we need this community element and society element to control Aedes aegypti. So I hope I have covered both aspects of the question. Thank you. Thank you, Director. Just to add to what Dr. Aldigueri mentioned, in 2016, the Zika declaration as a public health emergency of international significance was due to the fact that for the first time in 2016, it was determined that Zika was related to a completely new situation that was also unknown, and it had to do with microencephalitis. This is a very severe disease that was identified for the first time in the northeastern region of Brazil. It was known, but when Zika was known, but when the course of the disease changed and also the association to microencephalitis cases in Brazil, children born to women that had Zika during pregnancy, that was when WHO declared that this was a public health emergency globally until they were able to have a more comprehensive assessment. In the case of dengue, the only novelty here has to do with the significance, with the transmission, with the scope of the transmission, but there is no change in symptoms. So all of the recommendations that were issued over the last couple of years for dengue continue to apply. So this could be a situation that is completely different to the one that we had with Zika in 2016. Thank you. I thank you, Director. Now we have a question from the Caribbean.
Hello? Hi. Yes. Quickly, for me, in terms of the Caribbean region, what's the prevalence in terms of data, the level of infections and deaths that have been seen over the last 6 months to a year? What recommendations PAHU gave to small island states like St. Kitts, Nevis, Antigua, Barbados, and those that saw an upsurge recently in dengue cases? And specifically, and finally, in terms of vaccination, is it available widely? Is PAHU pushing to have those vaccines readily available for small states like those within the Caribbean region?
Thank you. Yeah. Good morning. Thanks for the question. So as I would have said earlier, in the Caribbean so far for the year, we've seen over 25,000 cases. 9,000 of those have been confirmed by laboratory tests. And in terms of severe cases, we've seen 86 and 3 deaths. A very important question about tourism, the relationship between tourism and dengue. And because these are small islands that are dependent on tourism, like St. Kitts and Nevis and Antigua, it's very important to get a handle on any outbreaks of any diseases, including dengue. And PAHO has worked with countries of the Caribbean, including these small islands, in controlling the Aedes aegypti mosquito. In terms of prevention, we would have spoken before about breeding sites. I know, for example, in Antigua and Barbuda, they're affected by drought, so there's a lot of water storage. So we have to encourage the public to store water safely so that they don't encourage the breeding of the Aedes aegypti mosquito, which is the vector that transmits dengue and other diseases. Additionally, waste management is also very important. This would have been mentioned before by the director. And of course, training of healthcare workers, those who work in hospitals and in clinics, so that they're able to detect cases early and report them. And also so that we can manage cases properly, so that cases don't progress to severe dengue and deaths. And a lot of training has been done over the years in countries of the Caribbean, especially the small islands. We train vector control officers in terms of detection and surveillance for the Aedes aegypti mosquito. We've also trained clinicians, as I would have said, and nurses included. We also provide equipment and improve lab capacity in the countries of the region so that they can detect cases earlier. And as Dr. Aldejani would have said, even if a capacity may not be available in one country, in the Caribbean, for example, in the Eastern Caribbean, lab capacity is available in the other countries, for example, in Barbados. And of course, we have the Caribbean Public Health Agency lab that is the reference lab per se for the Caribbean. In terms of vaccines, it would have been stated earlier that the vaccines for dengue are in a limited supply, but they are available through the PAHO revolving fund. And as would have been stated earlier before, we also encourage countries, if they would like to get vaccines, the dengue vaccine through the revolving fund, it has to be done according to the guidelines of the PAHO Technical Advisory Committee. Thank you.
I would like to give the floor now to Natalia Vitela, who is a journalist with Reforma in Mexico City. Natalia, can you hear us? Would you like to ask your question live? I am going to read what you wrote in the chat. Natalia Vitela with Reforma is asking, what is your assessment as to the dengue situation in Mexico? We see an unprecedented growth in the number of cases. Why is this happening in Mexico, and what is the solution? The question is whether Mexico is using the vaccines or whether they have requested them from PAHO. We start with the epidemiological situation with Dr. Aldiguieri. Thank you. Thank you for that question. I will be referring to the first part of the question as to the epidemiological situation. The federal authorities of health are regularly reporting to PAHO. We can confirm an uptick in the number of cases. As of the beginning of the year, there have been almost 41,000 suspicious cases reported. More than 8,000 were lab confirmed. This is usual practice. There have been no reports of deaths. We are now talking about a situation that shows an outbreak outside, beyond the expected season, as we see in most of Mesoamerica countries where we have red signs. And also the most affected states are Guerrero, Tabasco, and Quintana Roo. And the 4 serotypes have been identified throughout the last couple of months in Mexico. Mexico has a WHO collaborating center at the INDRI Institute in the capital city. I would like to refer to a specific situation that took place last year after the Letiz hurricane in the Acapulco area in the Guerrero state. And this allows us to underscore the importance of comprehensive management in post-disaster situations, including strengthening clinical care. And this is what the Mexican authorities have rigorously implemented with the support of the Pan American Health Organization, and also with support in between the states and with specialized practitioners. This is what I can report as to the situation in Mexico. Thank you. I thank you, Dr. Aldigueri. We have time for an additional question. I give the floor to Victor Ingracia from Infobae. Would you like to ask your question live? Victor? I don't know if he's still connected. Can you hear us, Victor? I am going to read his question. In spite of the efforts made by PAHO to launch training and alert, we see that the epidemic is going through a historical period. Do we need greater cooperation from the countries? Why don't we include the same program that we implemented in Colombia that had very good result with Wolbachia? Would you like to start, Dr. Aldigueri? Yes, and also the coordination among the countries. The coordination mechanisms at the sub-regional level are strongly activated in the area of outbreak, as to outbreaks in the southern hemisphere. We see constant exchange of information and permanent exchange of information, and our countries also have room for virtual cooperation by using information and also programs that include several countries so they can exchange their analysis, and this is something that is being promoted by PAHO. As to the new technologies for vector control, Wolbachia is one of the most advanced options that we have in the region. There are other techniques, including sterilization techniques for the mosquito. Wolbachia seems to be a very good technique for the future. Right now, it is not going to have an impact. We are having some pilot tests at the level of some of the municipalities and departments, and Wolbachia is not the technique that will have an impact on the dynamics of the epidemics that we are experiencing, but it is a good idea to expand the pilot tests as a good potential tool for the future, and I hope I have addressed your question. Thank you. Director, please, you have the floor. I thank you for the question. I just wanted to add to what Sylvain said, which was a very comprehensive answer, that dengue has a separate challenge. Whenever we have a dengue epidemic, the circulation is so strong that almost everyone has contact with the disease. And after 4 or 5 years, there is a new serotype. So we need to, and that's when we are going to have another outbreak. So this is not a situation that we have on an yearly basis in every country. This is a challenge because it seems that dengue disappeared, but this is a disease that is also that has very strong characteristics. For example, in southern cone countries, there is a very strong transmission in the first half of the year, and then weaker in the second half of the year. So it gives us the false impression that the disease has disappeared. So the countries need to have strong programs to clearly identify the beginning of the transmission, and even before the beginning of the transmission, when the proliferation of mosquitoes starts. PAHO, in addition to the new strategies for vector control that are being tested, such as mosquito sterilization and the use of the Wolbachia bacteria that prevents the mosquito from being infected with the virus, are promising techniques, but that still will take a couple of years until we have them as feasible for immediate use. But we already have strategies that are being used and that can be used, for example, stratifying risks to identify areas within a large urban region where we see the most accelerated spread of the mosquito, and see how we can focus our efforts to reduce the transmission. But 80%, almost 80% of the breeding areas are in people's homes or close to their homes. So that combination of having the government activity, but also with strong community participation, I think is key. And this is a tool that is already available to reduce significantly the possibility of having dengue outbreaks, and also this increase in the number of dengue cases as we see. And thank you very much for the question.
This is the end of our Q&A period. Now over to the director. Yes, thank you. I would like to thank you all for your participation. And I would like to end this press briefing, switching over to another topic, which is important, and it is the vaccination week in the Americas, which is an annual event in which the countries and territories of the region come together to offer life-saving vaccines to millions of people of all ages. In its 21-year history, Vaccination Week has helped countries to vaccinate 1.15 billion people. This initiative has contributed to the control of many diseases, as well as eliminating 6 vaccine preventable diseases such as polio, measles, rubella, congenital rubella syndrome, neonatal tetanus, and hepatitis B. This year, the week will be held from April 20 to 27 with the slogan, Act Now to Protect Your Future. Go get vaccinated. This campaign will focus on vaccines as part of an active life which continues without interruptions thanks to vaccine protection. In our region, we do not have indigenous transmission of polio or measles, but those viruses are still present in the world, and transmission can be reintroduced if you have inadequate vaccination coverage. Cases of measles are increasing in many parts of the world, for example, Asia, Africa, Europe, and 95% coverage, vaccination coverage, is needed to stop any possibility of outbreaks. Our countries are identifying measles cases. I urge the countries to use Vaccination Week as an opportunity to take concerted actions to increase coverage of routine vaccination against diseases such as measles and polio, but also to advance vaccination against HPV, a tool that can effectively eliminate deaths from cervical cancer, one of the most important causes of cancer death in women, and also to catch up with other important vaccines such as influenza or COVID-19. Closer to the Vaccination Week, we will hold an information or briefing session and also a press briefing to share the latest information about vaccination coverage in the Americas, and I invite you all to attend. I also invite you to follow the launch ceremony on the week of Monday, April 22 through the PAHO YouTube channel. Thank you very much. Thank you, Dr. Barbosa. Thank you, Director. Thank you, journalists. Thank you for your patience with our technical problems. This is the end of the session. Visit paho.org where you will find more information and links about the dengue situation in the region, and we will be at your disposal at communications in PAHO. You can send a mail to media team at paho.org. We will share more information about the press briefing for the vaccination week and the vaccination week per se. Great seeing you all, and greetings.
Bye-bye.